All right. Hello, everybody. Thank you, everybody, for coming in and tuning into the webinar tonight. I'm excited to give this one. Gave one a couple of months ago on regenerative medicine. This is sort of a branch off of that. We'll be speaking about similar topics, but really focusing on how regenerative medicine can help with hair restoration. So again, tonight's discussion will be about platelet-rich plasma hair restoration, a regenerative medicine approach to thinning hair. So some of my credentials here, I think that's important to talk about, because if I was sitting in the audience tonight, one of the first questions I would have, well, this guy's fellowship trained in interventional spinal procedures. He has a sports medicine board. He's board certified in physical medicine rehabilitation. So how does this fit in with hair restoration, which you might typically think is done under the guise of plastic surgery? Well, I've been in clinical practice in the Hudson Valley now for the past 12 years. My fellowship wasn't just in interventional pain management and sports medicine, but also had a significant amount of exposure to regenerative medicine through my fellowship director and my mentors during my fellowship. So that was my first experience with regenerative medicine. And I have been cultivating and practicing regenerative medicine within my practice for the past 10 years, 10 to 12 years that I've been up here up in Rhinebeck and with Orthopedic Associates. So the two aspects of hair restoration that we're going to talk about are injections and regenerative medicine. And I've clearly developed an expertise over the past 10 years in both of these. One of my sort of side interests and beginning to have a small following in functional medicine and regenerative medicine and anti-aging medicine. So they all sort of mesh well. And I thought this was a great opportunity and time to introduce this type of procedure to my practice and into the Hudson Valley. So I think that's my background. That's where I come from. And that's where my expertise lies. And that's why I feel like I fit an appropriate niche in this field. This is not a surgical procedure, but more of an injection procedure, which I, again, have 12 years of practice in that arena. So a quick overview of what I'd like to touch on today. We're going to talk about hair loss, just general physiology and biology between hair loss and the physiology of how hair grows. Then we'll go into some of the treatments for it, then really specifically talk about how the PRP works in hair loss. So our first slide here, types of hair loss. So there's a multitude of reasons why people lose hair. Our focus is not on this slide. We'll get to that in the next slide, but these three, Alopecia Areata, Telogen Effluvium, and Anagen Effluvium, are three types of hair loss that platelet-rich plasma does not help. So we're going to talk about them briefly, just so you have an understanding of these different patterns of hair loss and why these maybe won't work in the PRP realm, platelet-rich plasma, PRP. I'll use those interchangeably. So alopecia areata, this is a patchy hair loss. You've probably seen friends, neighbors, or people around which have just losses of hair, and you'll see circular patches of hair that are gone. They're well circumcised. There's absolutely no hair or hair follicle in the area of hair loss. And this is an autoimmune process. This requires more of treatment. Possibly a rheumatologist or a dermatologist should evaluate this, and there's more biological treatments for this or more medicinal treatments for this than the PRP. Moving on to the Telogen Effluvium and the Antigen Effluvium. These are more associated with systemic disease, pregnancy. This happens when women get pregnant. Their hair sometimes comes in a little thicker. Then after postpartum, their hair thins out significantly. You'll see this in thyroid disease. You'll see this in iron deficiency states and diabetes. So the hair, it's almost like a shock to the system. The hair, you'll lose hair diffusely throughout the scalp. Then after the insult passes, the hair starts to regrow anywhere between 6 and 8 months down the road. Diagnosis for this would be what is called a pull and a tug test. You tug on the hair. You're supposed to grab about 50 or 60 hairs or so. You give a nice little tug on them. And depending on how many come out in different areas, so it has to be in the back, the side, the top. And if it's falling out, that's a predictor of more of this process going on than the typical hair loss patterns that we'll be talking about. Anagen effluvium, it's a sudden and significant loss of most of your hair. And you'll see this, we all have had experience with family members or friends who are undergoing chemotherapy, and you see, well, they lost all their hair. Well, the chemotherapeutic agent has a toxic effect on the hair follicle, and then you'll see that hair loss. People typically, when that chemotherapeutic agent is removed, their hair will eventually start to grow back. So now we're going to talk about androgenic alopecia. This is the topic And this is the diagnosis where the platelet-rich plasma will come into play. This affects 80% of men and 40% of females. There are male and female hair pattern losses. And if you could see on that image on the right side of the screen here, male pattern, you lose from the sides and then in the back there, and then they sort of come into a confluence. Whereas women don't seem to have that same receding hairline, but what they'll see is a general thinning of all of their hair, and particularly in that same type of pattern on the top of the scalp. So both men and females suffer from this. It's typically called male pattern hair loss, but it's really androgenic alopecia, and it occurs at both men and women. So let's talk more now about hair growth and the basic physiology of hair growth. Your hair grows in 3 stages. Each strand of hair on your body, whether it's on your arm or on your scalp, is in its own stage of development in one of these 3 stages. Once it gets through all 3 stages, it just resets. The follicle generates a new strand of hair. So there's the anagen phase, which is the growth phase. Typically, hair in this phase will grow about 1 centimeter a month. 85 to 90% of the hair follicles on the scalp are in the anagen phase at any given time. It could last for years, and it's stimulated. Now, these by 2 molecules, that 2 of many different molecules can potentially stimulate it. I'm going to talk about these now because they'll come up later on when we talk about, hair growth in general, the physiology, and why PRP makes sense in this realm. So you could stimulate. IGF stands for insulin growth factor 1. PGE2 stands for prostaglandin E2. These are signaling molecules, or a language that the body uses, a chemical language that the body uses to talk to cells, cell to cell, both locally and from a foreign cell. A foreign cell inside the body, just at a distance, can signal to other cells to perform certain functions or stimulate growth. The Catagen phase of hair growth is a transitional phase. It lasts quickly, a week to 2 weeks. The follicle undergoes some changes, leading to the Telogen phase. The Telogen phase is the resting or the shedding phase. This is when your hair stops growing. The follicle starts to shrink. The hair readily starts to fall out. And 10 to 15% of all of your follicles are in this state. This typically lasts between 2 and 6 months before the follicle regenerates and goes back into the anagen phase. So that's the basic phases of hair growth throughout the body. Both the cells in the periphery as well as on the scalp follow these stages. So we'll talk about some common, everyday, most common hair loss treatments that if you go to your physician or even sometimes a dermatologist will be recommending these things to you. The first 2 on my list are the medications. These are both FDA-approved medications for hair restoration, hair treatment, hair regrowth. Minoxidil, this is a shampoo, essentially. It functions as a vasodilator topically, and it's been shown to maintain hair and prevent you from losing hair. And I'm not sure about regrowth, but it's one of the most commonly prescribed medications for hair loss. Moving on, an oral medication called Finasteride. It's a tablet that you'll have to take every day. It inhibits what's called DHT, dihydrotestosterone production. Men and women both have testosterone in their bodies, men at a factor much greater, but testosterone plays a vital role in both men and female regarding the anabolic stages, building muscle, repairing. But as we get older, your testosterone levels, you get into this imbalance, especially in the scalp, where you have an enzyme that converts testosterone into this DHT molecule. The DHT molecule shown in high levels in the scalp has been implicated in the reason why the follicle eventually fades and dies away. So by blocking the enzyme that produces the THC, you effectively reduce the concentration of the DHT in the scalp and provide that follicle with a better chance of survival. Both of these medications, however, require daily use and diligence when it comes to compliance with these medications if you want to see the benefits from them. The Finasteride is an oral medication. It does come along with side effects. It goes by the brand name of Propecia. If you're using it to treat your hair loss, if you're using it to treat your prostate, if you're a man, it goes by the name of Proscar. So this molecule also stimulates prostate cells to grow. So it's used twofold, one for hair loss and one for the prostate. It does have side effects, as any medication potentially can. So it comes along with its own risks. Other treatments that have been shown to be helpful is this red light or low level laser treatment, which has been shown to stimulate hair regrowth and maintain hair. And then the surgical procedure, which is a hair transplantation procedure, which is typically you'll visit with a plastic surgeon, and then you will discuss this type of surgical procedure. This is really the only treatment for balding. If you've lost your follicles are dead, you have no hair is growing at all, hair transplantation really is your only solution, and we'll touch on that later on also. And the more traditional ones have been around for centuries, which is hair pieces and wigs, and actually they function pretty well. There's clearly limitations with those, but I've seen some patients shocked at when I realized that they were actually wearing a hairpiece. So they're reasonable treatment options. It's non-invasive. There's no risk to it. It's just a matter of maintenance and being comfortable with wearing something like that all the time. Platelet-rich plasma is essentially, it's a blood product. Your plasma is the fluid that floats around your blood vessels that allows your cells and your proteins to be transported around the body. The platelet, we'll get into that a little bit more, but is a cell or a pseudocell that exists in the bloodstream. Platelet-rich plasma treatments have been used in clinical medicine since the 1980s. Their studies have been published in its use in oral surgery, cardiothoracic surgery, dermatology, plastic surgery, orthopedics, and sports medicine. Platelet-rich plasma is a safe and effective way of delivering biologically active molecules in higher concentrations than normal to areas of pathology. So I touched on this before, was part of my practice is regenerative medicine in the orthopedic world. So I'm doing platelet-rich plasma more typically for knee arthritis or rotator cuff injuries. And it makes sense to use these because it's the same rationale that we're going to use in the hair restoration, is you're providing a multitude of biologically active molecules, signaling molecules into areas that don't see a great blood supply. And it's providing for that area then to ramp up a healing or a regenerative response. And you're seeing across the board in studies too, that people do very well with this type of treatment, which is very safe also because it's autologous. It comes from your own body. There's no pharmaceutical involved with this treatment. So let's talk about the platelets a little bit. So I call it a pseudocell, and the reason why is because it's actually a fragment. It's a fragment of a stem cell that's inside of your bone marrow. Inside your bone marrow, you have different types of stem cells. Stem cells are cells, the progenitor cells, let's call them. And the stem cells that I'm talking about aren't the kind that, when you have a little cell inside a mother's womb and that turns into a baby. No, these cells have differentiated, I mean, they've come along the line a little bit and they can only do certain things. They can't go back and form a whole organism, but for what they need to do, they could recreate skeletal muscle tissue. They could recreate all types of tissue, but they have to be in a certain lineage. So in the bone marrow, you'll see megakaryocytes, that's the platelet stem cell. You'll see mesenchymal stem cells, and you'll also find the stem cells that produce our blood cells, our red, our white blood cells. But the megakaryocyte is the cell that produces the platelet. And what that cell does is it packages inside these little blebs of cytoplasm, of cellular material, all of these bioactive molecules that help the body sort of know what to do when it's injured and know how to recruit the appropriate cells and biological systems to help repair injury. And it orchestrates this. So our platelets, we've all learned in biology 101 or high school biology that the platelet is the cell that clots the blood. It stops you from bleeding out when you're injured. Yes, that's its first and most important mechanism of action. The next step, though, is as it's releasing all of these cytokines or signaling molecules, it's telling the local environment that there's an injury and that we need to start to repair this by recruiting other cells, by activating stem cells, and by coordinating this healing response that we have in our body. So again, these fragments contain biological active molecules that help orchestrate this response to injury. These molecules, as you've heard me say, are called cytokines, and they trigger growth and repair of the local environment by this signaling to these other cells. So they found that these cytokines are used by the hair follicle cells to stimulate the anagen phase. So the IGF-1 that I mentioned before it's found inside the platelet. So this is one of these molecules that the platelet already uses to go through its staging process and to create a new strand of hair. And if you could see on the table here, there's 1, 2, 3, 4, 5, 6. They mentioned 7 other growth factors. GF at the end of those initials means growth factor, platelet-derived growth factor, transforming growth factor, fibroblast growth factor. These are all molecules that are stimulating these cells to produce new blood vessels, to improve the blood supply to the area, to stimulate the cell into the growth phase. So we could see that the platelet is loaded with all of these molecules that this follicle uses to produce normal physiological hair. So we're sort of hijacking this system and telling those cells, hey, listen, let's get going again. Let's start producing hair again. So when we look at the literature, and I was pretty surprised at this, because like I said before, my expertise or my experience has always been more in the musculoskeletal world. But when I pulled this up and I did some literature research, as you'll find many, many more studies demonstrating the efficacy of hair restoration in PRP than you can actually find, I believe, for the musculoskeletal system, for some of the other stuff that we're doing and is having positive effects. But now we have, in this realm, there's a lot of literature to support the use of PRP for hair restoration. So I pulled 3 articles. They're review articles, they're meta-analysis articles in which the authors try to pool a bunch of studies together to increase the power of the study by increasing the number of participants. So they find studies that are very, very similar in the way they were conducted, the way the patients were selected, and the way the procedure was performed. And so we'll go through these 3 journal articles that I pulled up. So from the Journal of Cosmetic Dermatology in 2018, the meta-analysis of 6 studies concluded that the PRP for androgenic alopecia is associated with an increased number of hairs and some hair thickness. In 2019, in the International Journal of Women's Dermatology, they found that the use of PRP to treat androgenic alopecia is promising based on the results of the clinical reviews. The safety issues, side effects, and downtimes seem to be minimal. And then when we go on to the Facial Plastic Surgery Journal in 2018, there was overall positive clinical response to the use of PRP for hair restoration was observed in the literature reviewed. Its effect on hair density, count, and thickness have been demonstrated through multiple trials with positive effect noted in all studies that used at least 3 treatments. They were typically spaced about 4 to 6 weeks apart. And that's, that 3 treatment in that study is an important aspect of my clinical approach to this. I do believe, after reviewing the literature, that 3 is probably the optimal treatment. We could definitely start with 1 and see, how we progress and then consider moving forward. But planning for 3 treatments should be expected for ideal results. So the PRP hair restoration, what are the goals that we're looking to achieve on a biological level? So we want to keep the hair in the anagen phase, and we want to reduce the conversion to the telogen phase and reduce the time spent in the telogen phase, and overall improve the health of the follicle, prevent it from shrinking and potentially dying. So the PRP is used to achieve these goals through the introduction of these bioactive molecules, which signal to the cells to maintain anagen phase, transition from telogen, and improve the quality of hair. And we have seen that in the literature. This slide's very important. This is probably one of the more important slides, and one of the things I really want to stress when we talk about this. This treatment will not regrow new hair. So if you're, like I said before, if you've lost your hair, now I'm going to show you here. So my hair, I never had this little thing right here, and now there it is. So I'm losing right in there. Now, if I started shooting this up, now there's some little baby hairs here, those might come back, but to really fill this area in, I'm not going to grow hair back in that region. But these little hairs here, these little follicles that are still sort of hanging on, those would come back, as we see on the picture on the slide. You could see that I have sort of a very similar hairline there, where we see those thin, wispy hairs coming in, and then after the PRP injection, we want to see them coming in nice, thicker and fuller. So the hairline will maintain where it is, but it won't improve. It won't go back to growing new hair in that region. So again, the goal is to see an increased density of hair in the hairline and increased thickness of the hair. And like I said, I alluded to this before, and again now, is that new hair requires hair transplantation, which is a surgical procedure performed by a plastic surgeon. So I think that's very important because the expectations, we both need to be on the same page when we're talking about expectations from the physician standpoint as well as from the patient standpoint. So these would be discussions we would have when we do meet. So talking about that first meeting. So if this is something you might be interested in, we'll make an appointment for you. Appointment can be done. Ideally, appointments are done in person, but in today's world, a telemedicine appointment will be appropriate also until hopefully some of this stuff resolves and we can all get back together again. But we want to meet and discuss the procedure, discuss it in a little more detail than what we're doing tonight. Talk about, again, expectations from my expectations and your expectations, and then set a course of action, really. Examine the scalp and hair. See where the biggest trouble area is or the areas that you would want to focus on. And at that point, if we decide to pursue the procedure, we would plan accordingly from there. Set up a time and a date where we would have a good half hour to 40 minutes, probably closer to 40, 45 minutes to perform the procedure for you. So we'll talk a little bit more about the procedure now itself. So what to expect when you come in on the day of that procedure. Well, first we do informed consent. And informed consent just means we're going to discuss, again, the risks, the benefits, the alternatives to this procedure. We're going to talk again about the outcomes and what we should expect. And once we come to an agreement, we'll sign off on it both of us. At this point, then, what we'll do is prepare the platelet graft. The platelet graft is prepared right at the bedside. And that's one of the beauties of the procedure is everything is done pretty much right in front of you. You'll be able to see me draw the blood, see me spin the blood for the most part, depending on our setup, and then watch me create the graft. And that's done usually 10 to 15 minutes time to get that all completed. The blood draw is about 18 cc's, could be more, could be as high as 60, but 18 cc's. So expect to be anywhere between 1 and 2 ounces of blood will be drawn. It's no more than a typical blood draw that you have. Maybe a little bit more than a typical blood draw when you go for your primary doctor's blood work. Then we do a centrifugation of the blood, and we concentrate the platelets down anywhere between 3.5 to 5 baseline concentration. And that's the key. The concentration of the platelet is the key. We want to have a really strong concentration of those growth factors. So when they are injected, they are active and we see a nice robust response is what we're looking for. So at this point, all standard stuff, things that most people have been exposed to, which is the venipuncture, and typically not a big deal. Even if you're a hard stick, that's okay because we have an ultrasound machine typically with us and I could visualize the vein pretty well. So again, one of the pluses of being an expert in guided injection procedures. So when we get you ready for the injection, preferably you'll be seated comfortably in a reclining type chair, maybe lying down on a table. You know, it all depends on how you feel about sitting and anxiety levels and things like that. We're going to try to make everything as comfortable as possible. But typically a seated position, this way we can get to all the areas of the scalp without much moving around and to try to keep you as comfortable as possible. The scalp will be prepared for an injection. I'll typically use a combination of chlorhexidine and alcohol or a chloroprep type of solution. It's going to be more of a semi-sterile procedure because the hair is there, but we'll maintain as sterile as we can. And then we'll plan for multiple injection sites. This isn't a one and done type of injection. This is an injection where we'll be spreading those platelets out all throughout the scalp. It could be 20 injections and it could be as many as 60 to 70 injections, possibly more, depending on the extent of the area we're looking to treat. And again, multiple sites will be covered in the during the injection, and you have to be prepared. This will be uncomfortable, if not painful, outright painful while I'm doing the procedure. Not only does, remember the scalp, it's very tight skin right here. There's not a lot of soft tissue. There's not a lot of space for the fluid to move around. That tension itself will cause pain. The needle stick itself will cause some mild pain, but it's typically that pressure. The scalp is highly innervated and you'll feel a lot of pressure as we go along here. And then on top of that, the platelets sort of have a noxious stimuli when they first get in there. That initial pain though, while we're going through the procedure, that will calm down relatively quickly. And then you'll be left with sort of like a sore scalp. The entire procedure should take me from when I first start the injections to when I finish, may take between 10 and 20 minutes. But again, from the blood draw to the informed consent to, getting you prepared and then doing the procedure. Typically, I'm going to say between 40 and 45 minutes, maybe longer, maybe less. When you leave, you should expect your scalp will be sore. This soreness and pain maybe last for up to 7 days. And then the hair improvement, that's what we're here for. That's what we want to know about. You could see hair improvement as soon as 2 weeks, but it may take up to 4 weeks before you notice anything, possibly longer. But that 2 to 4 week mark is when we hope to start seeing some improvements. And as I alluded to before, studies say you may need additional injections to get the ideal results. This gentleman looks like he really has no hair growing in that one spot. And then on the next slide, it looks like it's grown in. So that's something that I really want to clarify, where he has the thin wisps in the receding hairline. Those would improve. I'm not sure if that whole hairline would come back like that picture. So I just want to make sure I clarify that one too. So we talked about some of these before, but even post-procedure, treatment with minoxidil might be helpful. And again, this is a non-hormonal treatment. We're not blocking any hormonal pathways like we are with the Propecia. I would recommend we stay on the Propecia initially after the procedure. If you came to see me and you were already taking this, I would most likely have you stick with it for a while. The red light therapy that we talked about before is another means of promoting hair growth and maybe facilitating the effects of the platelets. Another caveat that I'm going to throw out there, there's a new product on the market called an exosome. And an exosome is, I guess, analogous to a platelet overall. What an exosome is, and I've alluded to these stem cells that are in the bone marrow. So the mesenchymal stem cells, they have been using these and harvesting those little blebs that come off those stem cells, and they've been marketing these as exosomes. These are very similar to the platelet in that it's a delivery of these cytokines or these signaling factors directly into the area. That's something that we're starting to do more for the orthopedic world. I'm seeing some good results in the hair restoration world also. So that's something that can be discussed, and maybe as an alternative or a future procedure if we didn't get the results we were looking for with the platelets. So PRP hair restoration, the pros and the cons. One of the strongest positives when I do these types of procedures, whether for hair or for musculoskeletal issues, is the autologous nature of it. This is coming from your body. There's no chance of rejection. There's no chance of an adverse reaction to the platelets itself. It's great to watch me take the blood out and then put it right back in about 15 or 20 minutes later. It really is a pretty eloquent procedure if you think about how medicine has gone in the past and some of the complications of dealing with medications and transplants from other things, that we're not worried about anything. I'm not worried about the side effects. I'm worried about the discomfort when I do the procedure. I'm worried a little bit about the discomfort when you go home after the procedure. However, there is no concerns about what the platelet's going to do or what reaction you're going to have to. And then that just rolls right into the next point. It's safe. The studies do show efficacy in hair restoration. It's relatively non-invasive when you compare it to surgical procedures for the same issue. And it requires intermittent treatment, unlike the medicines and the minoxidil, where you have to apply this. Really, you have to be very diligent about keeping up with those treatments to get the ideal benefits from it. The cons. It doesn't really address that underlying hormonal imbalance that we talked about. It's not blocking the DHT production. So, that DHT is still going to be working on those follicles, and it may lead to only transient improvements. What does transient mean? Does it mean months? Does it mean years? I don't have a great answer to that question, but I think we will as time goes on. You may require multiple treatments, like I said before, as many as 3 treatments to achieve the desired results. And again, the procedure will be uncomfortable and painful, and the post-procedure, 7 days or so, you can also have some added discomfort. So is this for you? So, this is a question that really only you can answer. I can't answer it for you. I can help you answer some questions about it, but if it's for you, you have to reflect on the impact that your hair loss is having on you. Does it affect your self-esteem, your confidence? And you answer that question. You have to answer that question honestly. If it's not a big deal, then this treatment maybe isn't appropriate. But if it's affecting you on a social level and on a personal level, then this is a reasonable treatment option for you to investigate. Consider other treatments you've tried that may have failed. Is this similar? Is this different? Does the biology and the physiology that it just explained, does it make sense to you? That's an important part of treatment. In any treatment is the patient, we have to be a team going into this. It's not me treating you, but us treating you together. And you have to have that positive outlook on any treatment that you receive, whether it's cancer treatment or this hair restoration stuff. Having a positive outlook makes the outcomes better no matter what across the board. And then the bottom line is consider the cost of the treatment. And you have to ask yourself, can I afford this? Is this reasonable for me to move forward with? So that's a personal question. That's for a family and for yourself to answer. But that's my feeling on that stuff. And that's all my slides for tonight. So I try to be succinct. I try to give you some biology and physiology, and then give you some more of the nitty gritty about the procedure. So we'll open up to questions. I have Heidi Schrofer with me today. She's a representative who helps us. And she has a lot of information. She deals a lot with this kind of stuff, as well as Andy Shepard's on the line with us also. Both great resources for me in the regenerative medicine world. So
the first question we have is, what is the cost?
The way the costs are going to be set up is that we're planning on right now is doing the 3 treatments. So 3 treatments will cost you $2,500. If you opt just for 1 treatment, I believe it's $1,000 to start, and then $750 for subsequent treatments. So it all comes out to about the same. And then for the initial consultation, it's a $250 consultation fee, which is typically not covered by your insurance.
Does PRP work better in certain areas of the scalp? And is it something that needs to be done over a continued period? It'll
be effective no matter where I inject it, because remember, we're working with the follicle and the physiology of the follicle. So, that was one of the points I try to stress is that the physiology and the biology of the follicle is the same, whether it's in your arm or it's in your scalp. So it will have a positive effect on that follicle as long as we inject around the follicle. So whether it's on the side of the scalp, at the top of the scalp.
Does it need to be done over a continued period?
I would say no. And this is what I do with all of my regenerative injections. I will it's a typical question, will I need a repeat injection? And my feeling, and I've talked to other people, I've talked to Andy about this, about, just scheduling the next one 3 months down the road, or just getting ready for your next injection. I have a different approach sometimes. I like to sort of monitor things. Let's see how things are going. Are you happy with where you are in 2 months or in 3 months? Or if not, we can always jump back in. So it's not a hard and fast rule there. I expect, yes, you'll need further injections in the future. How quickly they need to be done and what the time frame is, that's individual. It's individual on your biology and on your response to the initial injection and your satisfaction with where you are. If you're very satisfied with where you are, I don't think there's any reason to jump in and do a second one.
Does insurance cover this?
Insurance does not cover this. I'm going to assume it's considered a cosmetic type of procedure, and most cosmetic procedures are not covered.
Is there a concern with PRP stem cell treatments?
Since the 1980s, we've seen no negative studies about this. Again, we're introducing normal physiology. We're not taking a cancer cell. We're not taking anything exogenous and putting it back in the body. These are all products that are floating around your bloodstream as it is, and your body regulates this stuff in a normal situation. I'm not sure if there's an underlying cancer, and you're injecting into a cancer cell. Could that potentially, now we're getting very theoretical right now, but and philosophical in a sense, but I think that no, we have very little concern because we're dealing with normal physiology, and the body has checks and balances to prevent these things from going awry.
Taking biotin helps with hair growth? ?
There, I could go through a number of supplements, and I've heard people rubbing castor oil on their head. I've heard people using a garlic castor oil mix. So there's a lot of theories about herbal remedies that can be helpful. I have no hard and fast studies to say this definitely works or this definitely doesn't work. So I would say biotin is in the health food realm. I mentioned I enjoy functional medicine and anti-aging medicine. So biotin is something that can hurt you and it can help you. So if it doesn't necessarily regrow your hair, it's a positive thing to have in your body.
Can PRP be used in conjunction with low laser therapy?
Yes. And that's something that I think Moving forward, that's something I would recommend. I've been looking at the products that are available out there. I'm trying to find some good ones that I can recommend to the patients, but I believe it's totally a reasonable adjunct to what we're doing with the PRP.
So if I can jump in on that, Joseph,
Please,
to
Andy.
respond to that question, both myself and Heidi are on the supply side. So we've got a great deal of experience working with a lot of clinics that do these types of treatments. One of the more recognizable national chains that do this actually gave me one of these for me to try, because we supply them with a bunch of their stuff. And I've been using it religiously. I sit at my desk where I am right now, and I stick this thing on. The data, they've done some clinical studies for the low light laser therapy, and they seem to be quite positive. I wouldn't say that it's been a dramatic improvement, but I use it in conjunction with PRP, and I am aware that, number one, that national chain do it. They charge an awful lot more than Dr. Dentico is. And it's very, very popular. It's a very, very popular treatment. So the answer simply is yes, you can combine the two.
Will hair come in gray if one is graying?
That's a good question. That is a very good question. I'm a little stumped on that one. Do you have any input on that one, Andy?
I do. I got a great one. I was a group in Chinatown in New York started using PRP for hair, and the patient that came in I was there for their training, and the patient was completely gray. And then I got a phone call about a month later, and the patient was ecstatic because the hair that had grown back with color. And so I was, we've discovered something. This is a game changer. But then it faded straight back out again. So it doesn't. It did for maybe a half a millimeter, and then it went back to normal. But for a moment there, everybody was excited.
Oh, that's interesting. It almost speaks to the rejuvenation of the follicle.
It was just exactly that. It was just re-excited and just had a chance to come back, but then unfortunately reverted back to its gray.
How can you tell whether follicles are still viable?
Oh, if there's hair. You're looking for even vellus hair. Vellus hair is the hair that grows like on your arms and that little tiny. If you see hair growing out of your scalp, there's a follicle there, and we can try to whip that follicle back up and rejuvenate it, like we just said, and to try to turn back the clock for that follicle, give it the environment it needs to feel and act young again.
Must one not color their hair long before their treatment? ? Will scabbing happen on the scalp where injected?
Scabbing should not happen. We're using relatively thin gauge needles. The scalp is very vascular, meaning that that skin overlying those injection sites is going to heal up relatively quickly. I don't expect any scarring at all. Potentially, can you have a scab initially? Yes, but that will resolve. I don't expect any scarring. As far as hair coloring, that's relatively irrelevant, I believe. My only concern is freshly colored hair. I don't want to solubilize any of the hair color and potentially inject it into the scalp through my prep activity. So, but that's, again, a theoretical concern that would even happen. So I don't have much of a concern about the hair coloring.
Would someone with controlled type 2 diabetes be an acceptable candidate for PRP?
Yes. It's actually, across the board, it's better than some other treatments. Leaving the hair world for a second, for a diabetic, steroid injections for musculoskeletal issues can really drive your sugar up. It could really put you a little bit out of whack. So some of my diabetic patients, we talk strongly about PRP for the musculoskeletal system. So as far as I'm concerned, for your scalp, there's no concerns at all.
Yeah, I've got to jump in on that as well. Typically, certainly about maybe 8 or 10 years ago, when PRP was really first beginning to popularize, often it was orthopedic physicians who had terrible surgical candidates because the patient was a diabetic, that they'd be like, well, we've run out of options, so let's at least give this PRP thing a try. So actually the foundation of PRP becoming popular is because it was a successful treatment in patients that had no other option to go to the operating room. So type 2 diabetics are very welcome and don't have any significant problems with it.
Is there a payment plan?
Office will work with you from the administrative side. If you're interested in it, you just have to talk to one of the office managers, and there is a payment plan that we could discuss.
Do you use anything for the pain or a blocker to numb the scalp?
Typically, no. But in our discussion, in our initial consultation, that's something we'll talk about, is how to manage the pain during the procedure and after the procedure. That's going to be very important to discuss. Pain management is one of my fields, so it's something that won't get brushed under the carpet.
After 3 treatments, will this need to be done again?
I anticipate it needing to be done again, but hopefully not for the foreseeable future. What I'm hoping to see is long-term benefit. But like I said, we're biologic. We're going to continue to age. We're going to continue to go through. And that's, I don't want to get off on this path, but that's where the functional medicine stuff comes in. That's where we talk about how to optimize lifestyle, to really optimize health and well-being. So I totally believe that, how you're taking care of yourself is going to dictate how well you respond to the treatment, whether I'm doing it for hair restoration or I'm doing it for, knee arthritis or meniscal tear. If you address the whole picture, the whole body, your outcome I always believe, is going to be better.
Is there a typical time frame within which the treatment would have to be redone?
Well, like I said before, I think if we're going to opt in and jump in and plan on doing the 3 treatments, or if you're planning on doing 1, I think that 4 to 6 week window is when we need to get the second treatment done.
Will you be able to tell from the initial consult if this will work?
Well, during the initial consult, I'll have a better sense. Are we treating the right hair loss pattern? If that's the first question I need to answer. Then we look and we'll go over what we should expect. Where I see the hairline, where I expect the density to improve. During that initial consultation, we'll get an idea, and I could draw a picture of where we expect you to get to. So yes, I think whether it'll be successful or not, that's predicting the future. And I always joke around, I wish I could predict the future. I wish I could, but I can't. So sometimes you gotta, jump into the pool and see how it works out for you. But again, we go back to those questions. Is this appropriate for me? How do you gauge that? That's something that, you have to reflect on yourself and make that decision and balance all of these factors in. The risk of it not helping me, which we're starting to feel, if our expectation is to prevent the hairline from receding, to improve the hair density and thickness within the hairline, if we are both on that same page, then we should expect some good results and success with it.
What about someone with hair loss from lupus?
Hair loss from lupus is going to be one of those. It's going to typically could potentially fall under the umbrella of a non-treatable type of problem. Typically, those runs of corticosteroids that they're put on will hurt the hair follicle. Medicines that are associated with lupus can cause this, or that are used to treat lupus can cause some hair loss. So lupus might fall under one of those other categories where it's more the systemic disease that's causing the problem than just the typical aging of the follicle, so to speak.
Quick research states that PRP is not as effective in those with low platelet count. Can this be tested for prior to committing? Typically,
when we're talking about platelet counts that are low, these are usually pathological situations that the patient typically knows about. If you have a history of low platelets, that's something that should definitely be brought up in the initial consultation, and we could check the platelet level before heading in. But most people are walking around with greater than 150,000 platelets at any one time. That's sort of, that's your baseline normal number. And I think it's reasonable at that level. Anything above that level is fine. Anything below that level, like I said, is typically pathologic. You should know about that. But I typically don't test platelet levels before PRP injections. It's really not standard of care. And like I said, if your platelets are that low, it should be worked up and with a hematologist or your primary care doctor.
My hair is very fine and sparse. Does this injection destroy any hair follicles at the injection site, and how many?
No, it's not going to destroy the follicles at all. And in fact, how you're describing your scalp is exactly what the treatment is for, is to improve the health of those follicles so those hair strands start coming in thicker and the density of those hair strands starts to improve also.
At which locations is this procedure available?
Right now, it's going to be available in the Poughkeepsie and Rhinebeck offices.
Have you had any success with male seniors that have lost a good amount of hair to date?
Again, it really, if you have follicles, if you have thinning hair, this can be a successful treatment for you in improving the density and the thickness of the hair that you do have. I'm not going to regrow hair in areas that you don't have follicles, but we can improve the quality, the density, and the thickness of each strand of hair using the PRP.
Does this work for a little hair loss or a lot of hair loss, or it doesn't matter?
Does not matter. It does not matter. Like I was showing you my scalp here, I'm definitely thinning out in some spots where I wasn't before. And so this little spot, you know, right in here and on the other side there, that's what I would, if I went in for treatment, you know, that's what I would be pointing out as my problem area. And so even though it seems like it's a little for me, you know, that's something that could fill in. And I believe that's going to be something that's going to prevent that continual recession backwards. So no, it doesn't matter. I mean, I've had a lot of people since I've started talking about this at the practice come over to me and talk about. So it doesn't matter if you have that nice, you know, really thinned out spot up there, or you're more like me where you just have like these wings developing on either side. It's appropriate and could be effective treatment for both.
Is there a possibility that hair will grow somewhere near the injection site, like on the low forehead, nose, or temple?
No, it's going to be a localized effect, and it's going to have the effect on the follicles that it's intimately associated with from the injection site. So no, and there are no hair follicles on your nose. So it's not going to generate an independent cell and hair follicle. That's a complex, essentially organ in our body that has innervation, has blood supply. So unless you have a follicle there, the PRP is not going to all of a sudden create something out of nowhere. And the same thing, even if it was a stem cell injection or the exosomes that I mentioned, they're not going to generate tissue, so to speak, or organs, but they're going to take what's there and they're going to tap into that natural or normal physiology and try to boost it.
Does it go along with hormone replacement therapy? So it's been well observed for both male and female patients taking hormone replacement therapy. At the start of Dr. Dentico's presentation, he talked about the hormone imbalance causing hair loss. And so whenever hormones are not optimized, there's a greater chance of hair loss, and a great way of treating that is PRP. That's a major source of what we do.
Just that, you know, you open up a whole avenue of discussion right there, to be honest with you, about hormone balance and wellness. And you know, that's an important aspect of things is, you know, taking that plunge and saying, you know what, let me talk to him about this stuff too, because then you're looking at cortisol levels, thyroid levels, and you're getting a better sense of, you know, what that whole person's physiology is about. And then from that point, if you do optimize hormones, sometimes that alone can stop some hair loss, especially if we're dealing with cortisol levels, stress, and cortisol levels. That's a big issue. And I believe it drives a lot of hair loss also. So, you know, balancing hormones, not just your testosterone, your estrogens, but that whole interplay of the hormones is an important thing to look at, not just in hair loss, but just in overall well-being and stuff.
Why aren't you getting treated for your little bit of hair loss? Don't you want to see as a practitioner that works or not?
Why haven't I done it? Again, I'm pointing these things out on me. Do I feel the need to rush in to get it right now? No. When I look at that list that I gave before, it's reflect on what's important to you, and, you know, think, and, you know, so if I self-reflect on this, it's not one of my biggest concerns right now. It's really not. It's so I think that's important. You know, everybody's an individual. Just because I'm exposed to this, I could do it, and I think it's appropriate. It's not necessarily appropriate for me right now. So, and I think that's the important aspect of personalizing medicine to people, and making sure that what I'm doing as a physician isn't just like a broad brush of or cookie cutter kind of stuff, but it's sitting down with that individual and, you know, finding out what's going on and trying to come to the right answer. I do that a lot in pain management. I do that a lot in functional medicine. There's a lot of crossover with the things that I do. And I think that just comes from the physiatric training, becoming a physiatrist. A physiatrist is an interesting field of medicine where you learn a lot of different stuff over the course of your training, and you become specialized, but you're such a generalist to begin with. And so I think there's so much overlap in functional medicine, in orthopedics, in pain medicine. And I try to incorporate all that stuff into every interaction with a patient. And that's something that's become very important about personalizing medicine to the individuals. I just want to thank everybody who tuned in. If you didn't get your question answered, just give me a call and come in and we'll discuss it even further and probably in a little more detail.